Hi everybody, this is Michelle from Virtual Hand Care. In this video, we are going to talk about the difference between a DUPUYTRE'Ns contracture and trigger finger. So sometimes when people have injuries of their hand, there are some diagnoses that are very similar to one another, and that is a DUPUYTRE'Ns and a trigger finger. Now, the difference between the two is huge. A trigger finger is more of an overuse, repetitive motion type injury. It's more of an inflammation of your tendon and the fluid that's around the tendon. Our tendons are encompassed by a synovial sheath. So basically that's like a cover for our tendon, and within that cover there is fluid that's inside that to help lubricate the tendon so it can move nicely along our finger. And there are pulleys within that sheath that help hold the tendon down to our bone, kind of like eyelets on a fishing line. Now, when that fluid gets inflamed, it's basically like pulling a rope or a hose through like muck and mud versus having the hose pulled through water. So the tendon, normally is pulled nicely through more of a fluidous synovial fluid, whereas when you have a trigger finger, it's pulling through some muck. It can't move and glide very well. And so as it's trying to, move through different areas, as the tendon's trying to move through our pulley, it gets stuck because it's swollen and inflamed in that area. And so what happens is what you feel is like a clicking or a popping, or sometimes it can even get stuck down. And then you have to manually pull that finger back up. So the tendon gets stuck because it's basically too big for the space that it has to move through as you pull down. So you're able to pull down through that space, but then once you go to try to open your hand and the tendon tries to go back up through that narrow little space, it's too swollen to make its way back up through that space. So then you might get that popping or snapping, or like I said, it might just get stuck and then you have to physically open that. Those are more symptoms of a trigger finger. Now, on the other hand, DUPUYTRE'Ns is more of changes in what's called your fascia tissue in your palm. Now, that is more of a hereditary disease where the tissue in the palm becomes contracted and will start pulling your fingers down into the palm. You may even have it up into the finger. It's very common to have it into the small finger and into the ring finger, but you can also get it in the thumb as well as the index and the middle finger. The tissue is a lot different looking in the hand, in the palm with the DUPUYTRE'Ns. It's more thick. Sometimes what you usually start noticing is this cord that develops. So it looks almost like that. It almost looks like your tendon is kind of popping away from the hand, and it's very thick. It can be very hard. Typically with the DUPUYTRE'Ns, you don't have pain. It's not a tendinitis. It's not an inflammatory type injury. It's a change of the tissue. Now, it can greatly limit your motion because over time it can pull your finger or fingers down kind of into your palm. It usually affects older adults. However, I have seen people as young as 35 have DUPUYTRE'Ns. However, it is mostly of older males in the 60s, 70s, and 80-year-old range. There is big differences between those two, and with with trigger finger, that really can affect anybody. It is very common in women and or in people that repetitively use their hand a lot for certain activities. But like I said, they're very different though. One is more of a genetic component that affects the tissue of the hand, doesn't cause clicking and popping like a trigger finger does. The way that you can tell if you have that is by the clicking, popping, or the finger getting stuck down. And usually you can manually lift that back up. Now, if you've had that for a long time, sometimes what happens is you can develop what's called a contracture. So it can mimic a Dupuytren's. So if you've had an ongoing trigger finger for a long time, eventually the finger can start kind of pulling down because it just can't go all the way through that pulley. Remember, it gets stuck and it just can't straighten all the way through to where you can straighten your finger all the way up. With a Dupuytren's though, you can try to straighten as much as possible, but there's usually no give, and most people will say it feels hard as a rock, and it's just solid, thick feeling into the hand and into the finger. Trigger finger is a little more painful. Dupuytren's is usually not painful. Trigger finger usually clicks and pops and snaps and gets your hand stuck down. With Dupuytren's, there's a progression, and usually you can still move your finger down, but you can't straighten it, but there's usually no popping and cracking going on. Sometimes as the Dupuytren's gets worse, your finger will just stay down and you can't even bring it up or straighten it because the tissue has basically just kind of fixed itself onto your tendons and the tissue in your hand. It's very important to make sure that you do get that looked at by a hand surgeon. Make sure you see a hand surgeon, make sure that you see a hand therapist so that they can truly determine the difference between a Dupuytren's and between trigger finger, because there is different treatments that you would do for each of those. If you're interested in a video to talk more about treatments, comment below, ask your questions, like this video, and subscribe to Virtual Hand Care. I hope this video helped you. Let me know in the comments below. I know there's a lot of information out there, and sometimes I know it's hard to get the answers to your questions. If you want to learn more, please visit virtualhandcare.com. Thanks for watching.